Welcome again to the Gallo Radio Show on SuperTalk, Mississippi. Glad to be with you on this Thursday morning alongside Lance. I'm Richard. We welcome our first guest of the day into the conversation, Dr. Dan Edney. He is the state health officer with the Mississippi State Department of Health. Dr. Edney, good morning.
Good morning, Richard. Glad to be with y'all. Lance, you know you're supposed to play the colonoscopy song.
I will look it up. I'll see if I can find it.
We definitely. I mean, who doesn't need a colonoscopy song at 20 minutes after 7, first thing in the morning? It's that time of the year, right? Allergy season, cold season, flu season. What are you and all the folks at MSDH focused on as we kind of enter into this transition time of year where it's fall? No, wait, it's still summer. No, it's fall. No, it's still summer. Oh, wait. It's snowing.
Right. Well, I was pleased that y'all wanted to talk about that this morning. This is the time of year to prepare for the winter time. And, those of us with homes need to be winterizing our homes about this time of year, and it's time to winterize our bodies. And that is we are prime time for getting our vaccinations to get ready for our peak flu season. And now with the combination of flu, COVID, and RSV, we really call it our respiratory illness season. And all three of those are extremely important and cause excess illness and excess death nationwide, and that's certainly true in Mississippi. So we have vaccinations for all three of those respiratory illnesses. We are seeing increase in the number of deaths among our children nationwide. We had the highest number of pediatric flu deaths last year at 200, and that number is rising. And we are seeing a trend of decreasing vaccinations, and with that we're seeing an increased trend of severe illness and death. So especially for our very young and our older folks, we need to get ready for wintertime with our vaccination prevention.
Is there anything in particular that you attribute the decrease in vaccinations to? I mean, is it the lasting distrust of COVID vaccines and still not knowing all the effects of that has maybe contributed to even fewer people getting flu vaccines?
We think so in public health. We are, the anti-vax trend continues to be a dangerous public health issue nationwide, and it is in the state. We're actually, this last year, saw the highest number of pertussis cases, which is another lethal childhood disease that's vaccine preventable. We've seen the highest cases in Mississippi that we've seen in a long time. So we in Mississippi still lead the nation in the rate of childhood vaccinations. We're number one in the country, but we score very low when we look at flu shots and pneumonia shots. And that trend, I think people just coming out of the pandemic, maybe just some vaccination fatigue with all that was going on during the pandemic. But, what I'm trying to remind folks, we're talking about, especially with the flu shot has been around as long as I've been around, and that's a long time. Richard, I have been taking my flu shot annually since I started medical school in 1984, and I have not had a significant case of flu since then. And all during my younger years, I was taking my flu shot because I really didn't want to miss a week of work because of the flu. I didn't want to be flat on my back, really sick. And if you hadn't had a real case of flu, flu makes you really sick.
So I'm glad you said that, because I feel like flu is something that people kind of throw around in terms of
wastebasket.
Like, hey, you got a stomach bug. Oh, I had the flu. I was kind of feeling achy. Oh, you had the flu. But people who have had the flu, we'll say it in all capital letters, it's the one where you can't get out of bed for days, sometimes for a week, and it just really debilitates you. How do you delineate between those two?
Well, true influenza, and not just the wastebasket diagnosis of flu. True influenza, you have high fever, typically 102 or higher, severe cough, as it progresses, shortness of breath, and if it progresses to pneumonia is when it causes increased risk of hospitalization and death. So, and you are very sick. You're not up watching a lot of TV. You are flat on your back sick. And I haven't had a case of that really since probably 1982. But I take my flu shot every year. And now at 63, I take it because I don't want to wind up in the hospital with the flu, and I sure don't want to die of the flu. But, the flu shot is not meant to protect you from getting the flu. Although it's done a great job for me, it is to protect you from dying from the flu or having a severe case of flu.
Well, and that's what I was going to ask you. I mean, we hear about different flu strains. Like at one point there was A and there was B, and that's what people were concerned about. Mm-hmm. And did you get the flu shot that matched the strain that was most prevalent in that particular year? So with the different strains that exist of influenza on a year-to-year basis, and they seem to be growing, is there a one-size-fits-all flu shot, or is that kind of what you're talking about?
Yeah, not yet. The holy grail for us is the universal vaccine, because our big fear is the super flu hitting again like it did in 1918. COVID was not, the super bug that we fear. It was bad enough, but the super flu is what we fear. And so the universal vaccine that will cover all strains all the time is where the research is. What we have to do still is we study the Southern Hemisphere flu cases. We look, because their flu season is ahead of ours. We see what's circulating down there, and then that's what we base our formulation on each year for our fall doses. And we cover, the flu shot covers all the predominant strains that are being seen in the other parts of the world. But, we never know until our flu season really kicks off what we're going to deal with.
Visiting with Dr. Dan Edney. He is the State Health Officer for the Mississippi State Department of Health, joining us in studio this morning. I apologize if this is an uncomfortable question. It probably isn't, and it's probably something you've given a lot of thought to. Is the job of state health agencies more difficult than it was 4 years ago because of a lack of trust that exists on a lot of fronts?
Well, I can tell you, we enjoy a high degree of trust in Mississippi, and Mississippi State Department of Health has been serving Mississippians going back to 1877 with the initiation of the Board of Health. So we're a known entity. We're also apolitical. We are governed by the Board of Health. And so we set the agenda for public health in our state based off of what's important to the Board of Health and to us at the agency, and folks know that. So they know whenever I'm visiting with you and others that I'm sharing what I see, what I know to be true, not political issues, not beliefs, but what the science is showing us. And I think we were able to navigate our way through the pandemic in a trusted fashion, working with elected officials, working with community partners, working with the public, and we were seen as that resource of trusted information. There are times that we disagree with the CDC, and we stand on what we see for public health science in Mississippi and what the public health needs in Mississippi are. But I'll tell you where our real challenge is funding. So funding now for public health is certainly at the state level is at an all-time low in modern history. We had historically robust funding for public health because we had so many needs, and that has really dwindled since 2017. But I am very proud that because of that trust and because of our focus on improving the population health for Mississippi, that last year in the legislature we had extra funding specifically for public health programming like attacking congenital syphilis, working to rebuild the public health infrastructure of the county health departments, working on the state health plan to have thoughtful strategy at a state level for making Mississippi healthier, rather than investing in a state agency, investing in public health programming that's evidence-based and shown to help people live longer than we are in Mississippi. It's extremely important to me that we have the lowest life expectancy in this country. And it's very important to me that we have the highest rate of preventable death, which means more Mississippians die unnecessarily every year than anywhere else in the country. And as a Mississippi physician and as a Mississippian, much less state health officer, that's unacceptable. We can do better.
Visiting with Dr. Dan Edney. You got time to hang with us for a few more minutes?
Absolutely.
All right, we'll take a quick break. This is the Gallo Radio Show on SuperTalk Mississippi. More coming up with Dr. Dan Edney. He is the State Health Officer with the State Department of Health. Glad to be with you on this Thursday morning. I'll say it again because it just sounds so good. Weekend just around the corner. And a beautiful weekend coming up here in the Magnolia State. Quick time out. We're back right after this. It's the Gallo Radio Show on SuperTalk Mississippi.
That will surely clean you out. Your numbers up, it's time to.
There you go. You want to smile out of the good doctor? That's how you get it. Play the colonoscopy song on a Thursday morning. This is the Gallo Radio Show on SuperTalk Mississippi. Dr. Dan Edney is my guest. He is the State Health Officer here in Mississippi. We're there. We might as well just hit it. Colonoscopy, what's the age for men? When do they need to be getting it? Is this something that women should be concerned about as well?
Yes. Everyone 45 and older should have their screening colonoscopies. We lead the country in colon cancer deaths. And colon cancer is a preventable illness, Richard. It's not just we're trying to find it early. We're trying to find it in the stages where polyps are forming, where we can get those out before they ever turn cancerous. So 45 and older, I've had mine. I hope y'all have had yours.
Well, I'm not eligible yet, actually.
You could have fooled me looking at you. So.
Oh, thank you. I will be 44 in November, so I'm on
You're
the
getting
clock.
Close. You're ready.
But yeah, got that coming down the pike.
Great.
Visiting with Dr. Dan Edney. I want to ask you something, and I know you said apolitical a second ago, and I hope this question is apolitical in nature as it pertains to the Department of Health. Robert F. Kennedy Jr. has been in the news a lot. He obviously has thrown his support behind former President Trump. But it seems that the reason he has done that is because Trump has kind of given him an audience for a cause that is very important to him, and that's dealing with processed foods and kind of where we are in the foods that we are eating on a daily basis, leading to cancer because of the way they are made, because of the way they are grown, because of the way they are fertilized and sprayed, and all of those things. We had a question on the C Spire text line that was asking about that a second ago, and kind of where the Department of Health stands on processed foods and what this issue is.
Yeah, a new initiative in public health nationwide is food as medicine. And a big part of our being an unhealthy population in Mississippi, and look, this is not just a minority community thing. This is the entire population of Mississippi, by and large, it's demonstrating very poor health outcomes. A lot of it relates to access to healthy food, and a lot of what's available to the majority of Mississippians, especially in very rural areas, is processed, unhealthy food, food that's high calorie, low nutritional value. There's a lot more science that needs to be done on the issues, on the exact dangers in terms of long-term genetic changes that cause cancer with different types of processed foods. But, I mean, we know that fresh, healthy food helps us cardiovascularly, reduces obesity, reduces diabetes. We have enough evidence to be worried about cancer. Yeah. But in Mississippi, we have too many folks who live more than 30-minute drive from a true supermarket. A lot of us are insulated from that fact, but it's a real thing. And transportation is our number one social determinant of health coming out of poverty in Mississippi. And transportation challenges get in the way of everything, including shopping for healthy food. Look, I'm a big proponent that the SNAP program, our EBT cards, should only be buying healthy food. It should not be buying junk food. There's plenty of opportunity for us to assist our low-income folks to buy healthy food and not make things worse by buying these really high-caloric, low-nutritional value foods that, are just driving obesity numbers in Mississippi.
Is it worth it to pay extra for organic, or is that a scam?
Well, I think we'll know more as more research is done in terms of also making sure that, that organic has a clear definition and means the same thing at each retail outlet. But also, what is the risk-benefit of organic versus just food that are still healthy but wouldn't get the organic label. I think the verdict is out on that. But, the main thing is just, concentrating on foods with lower calories, less fat, more roughage, higher fiber. I mean, all that things that we have known for a long time that we just have to be Mississippians that have challenges accessing it.
Like when my mom told me, hey, the more colorful your plate, the better.
Absolutely. My grandchildren have been raised on broccoli.
There you go.
I can promise you my children were not, but my grandchildren are being.
Yeah, maybe we learn from our mistakes.
We do learn.
Visiting with Dr. Dan Edney. He's the state health officer with the State Department of Health here in Mississippi. Looking back on the COVID vaccine and the crisis time of COVID, when our hospitals were full, our healthcare workers were overworked, there were a lot of people that were really, really sick, and unfortunately there were a lot of people that died. Can two things be true at once? That the widespread acceptance of the vaccine at that time helped slow the pandemic that we were dealing with, and also it's possible that there's stuff that we didn't know, and there are after effects that we could be dealing with for years to come.
Absolutely, both can be true. I'll remind y'all that I was on the front lines in Vicksburg, right, in the hospital, in the ICUs in Vicksburg, treating COVID at the bedside.
And it was real.
And it was very real. I also was taking care of nursing home patients, and the darkest day I had as a physician was making rounds in my nursing home once COVID got in. This was all before the vaccine came out. And we were seeing healthcare worker deaths about 20% higher than the general population. So as I was waiting for COVID to get here, we in healthcare were all having to make decisions what we were going to have to do. And we were all praying for a vaccine and had little hope that one would come in time. And I was willing to accept a much higher complication rate from any vaccine that would give me some protection against what I was up against. So for President Trump with, Operation Warp Speed to have, really just brilliantly come out with the answer for us in our darkest days. People have forgotten all that. So, and I as I was counseling patients, I was telling them, the guinea pigs are going to be the doctors and the nurses who are desperately needing this. There will be hundreds of thousands of us vaccinated before anybody else. And Richard, we're, more than 5 years in, billions of people vaccinated. The science is pretty clear that the vaccine was clearly effective, was very safe. We did learn things, and we changed course, like the Johnson & Johnson vaccine that was causing cardiomyopathy being pulled. That's because it was being intensely monitored. And one thing folks don't know about vaccinations, the vaccines that we have, they are the most regulated part of pharmaceuticals because they're preventing illnesses, not treating illnesses. So chemotherapeutic agents have less rigorous study than vaccines have. So it's the vaccine supply that we have, what's available to the general public, is very safe, very effective, and intensely scrutinized on an ongoing basis. Even the flu shot, we report all the reactions that we see because all vaccines can cause reactions. And it's important to remember, any medicine can cause anything to anybody. what we look at are the risk and benefits. And the fact that we have saved in Mississippi tens of thousands of babies and children since 1979 with our vaccine laws far outweighs the small number of vaccine reactions that we've had over the years, all of which are really important and highly studied. But we saved millions of Americans through the vaccination efforts of the pandemic. And I was looking at our COVID deaths recently, and we had about twice the number of COVID deaths in Mississippi than we should have compared to the rest of the country because our vaccination rate was relatively low compared to the rest of the country. We got about half the population vaccinated during the pandemic in Mississippi.
Just about out of time. A question that we got on the C-Spire text line. You were talking about flu season earlier and flu vaccine, pneumonia vaccine, COVID vaccine, all available. We got a question. Can you take all three of those at the same time?
You can. You don't have to. You can spread them out. I take mine all at the same time because my wife reacts just looking at the vaccine. I don't react at all, so I just take all mine at one time and
get it, be done with it,
get it over with. So some people have more vigorous immune response. So if you tend to run fever, spread them out. If you don't, like me, take them all at one time.
Dr. Dan Edney from the Mississippi Department of Health. He is our state health officer. Thanks so much for coming in this morning. Really enjoyed the visit.
My pleasure, Richard. Anytime.
This is the Gallo Radio Show. Appreciate Dr. Edney's time. Hope that was an insightful conversation from you. I'm looking at the C-Spire text line. Not everybody agrees, and that's okay. But we can certainly have the conversations and try to look at all the sides that are there. We will wrap up the 7 o'clock hour with you coming up next right here on SuperTalk Mississippi.